Well, hello everybody, and thank you for joining me for today's awards ceremony on behalf of the Illinois chapter of the American Planning Association. Congratulations on being awarded the Public Outreach Award for the Bloomington Normal Consolidated Plan. So give yourselves a congratulatory hello. How's everybody doing?
Good.
Good. So let's go around and do just quick introductions. Taylor, I'll start with you.
Sure. I'm Taylor Long. I'm the Associate Planner for the Town of Normal.
Lauren Gibson, Community Planner at the McLean County Regional Planning Commission.
Jennifer Toney. I'm the Grants Coordinator for the City of Bloomington's Economic and Community Development Department.
Excellent. Well, thank you, Taylor, Lauren, and Jennifer. So again, congratulations. I think this is very exciting. I thought maybe we would just ask you a couple of questions about the plan development process. But first, I want to know a little bit more just about the team that was involved in making this happen. So whoever wants to start.
Yeah, so this all really began in 2017 with the completion of a regional housing study for the Bloomington, Normal, McLean County area that really emphasized more interjurisdictional coordination related to housing and community development. So that was kind of the impetus that brought the city, the town, and the McLean County Regional Planning Commission together to work on this. And we also included our partners at the Bloomington Housing Authority, PATH, which is our local continuum of care coordinator, as well as the McLean County Behavioral Health Coordinating Council that's a part of McLean County.
Okay, excellent. Sounds like a lot of people were involved. I think that's great. And I didn't hear any consultant names in there, so it sounds like this was done in-house, which is great.
Yes, we did this all in-house.
Excellent. So let's talk a little bit about the plan's development itself. Maybe give us a little bit of where you came from and how you got started on this particular one. I know that plans never are starting from zero, so maybe you had something that you were working off of a previous planning effort, for example, or something like that.
Yeah, so we knew going into creating our consolidated plan that we wanted to do something a little more outreach to create a different type of plan than we'd had in the past. As with most communities, both the city and the town CDBG staff is limited to one person apiece, Taylor and I, and creating a consolidated plan when it's the first time you've been responsible for doing it is very overwhelming. So it made sense for us to do it as a collaborative effort, especially with the recommendation from the 2017 housing study to do things on a more regional basis. It became obvious right away that by coordinating our efforts, we were going to be able to have a more robust outreach campaign than either one of us could have done individually by ourselves. And so by doing that, we were able to really tailor our outreach plans to our residents that were actually going to be using the services. And so we came up with plans that were a lot more meaningful maybe than the plans that we've had in the past. So this was a really good opportunity for both communities and then also the Regional Planning Commission to gather so much information from our residents that we're using it way beyond the consolidated planning. I just submitted a grant application last week where I pulled information from the analysis document that we had from this because it's very meaningful information for our community.
That's great. Taylor, did you want to add to that? I know you were involved in that as well.
No, I would just echo what Jennifer said. When you come in and you take over kind of the administration of the CDBG program, if the consolidated plan predates you, you're kind of set to the priorities and activities that it identifies. So you're playing catch up for a number of years and just trying to finish out something that you weren't a part of. So for being around for the creation of the consolidated plan, you're up to date yourself. You're able to go about meeting the priorities that are new and true to your community at that time. So it just made sense. It was a recommendation from a study, but it also just made sense to do things more regionally here. So that's kind of a growing emphasis. So no, Jennifer hit the nail on the head.
All right, well, that's great. I think it sounds like it was a good partnership from day one. And, you know, to what you said, Jennifer, if you're already using it in grant applications, that's obviously a sign of success. So hats off to you for doing that. So now to the kind of the meat and potatoes of it. I think that the thing that is obviously standing out in the plan is the engagement process, the award-winning feature. So maybe you could tell us a little bit about that strategy and how it worked for you.
Yeah, so as we started this planning process, we knew that engagement was really going to be the core. So as we were planning the different steps and different phases of what needed to be done, we really centered around that and gave ourselves a lot of flexibility to adjust to different, opportunities for engagement, as well as to leave us time to go out and connect with people that we may have missed in the beginning. So I think and that really solidified what our core outreach was with this, was to meet people where they are. So instead of having just a few sessions at City Hall or something like that, we really we went out to 30 different community events throughout summer of 2019. About over 60 hours of on the ground community outreach between the three of us. So people are more comfortable in situations that that they would be at normally. So we went to a Bloomington Parks Day where we had Legos for kids to build, little Lego neighborhoods while we talked to their parents and had them fill out their surveys. We went to places where we knew that low to moderate income population was going to be. We really wanted to target them, since essentially that's what the funds from CDBG benefit. So we went to food pantries, we went to homeless shelters, we went to different piecemeal locations for elderly, low-income people, and we really had meaningful conversations beyond just having these people fill out the surveys. And I think that really formed a lot of what we did with this plan, was to have those one-on-one conversations, to meet people where they are, and to get really meaningful feedback with the trust of the community.
It sounds like there was a lot of energy that went into that. And it sounds as though, just like you said earlier, Jennifer, about talking about that, you're starting to use this. So I just, out of curiosity, it sounds like some things have already started moving in terms of implementation as a result of that effort.
Yeah, in addition to being able to use the data for other things, we were able to analyze the data to come up with some new priority areas for this 5-year plan, compared to some of our priority areas that had been repeated year after year after year without a lot of additional outreach. So I know for the city, this year is a few things that rose to the top that we haven't really focused on a lot, was job training and workforce development, and then accessibility improvements was huge. So we are looking at now at all of our projects through the lens of accessibility concerns, and how we can, if we're putting in a new park, how can we make that park more accessible for all of our residents? And so not only in the con plan, but we're using that information throughout the community to bring in other resources and just make sure that we're meeting everybody's needs.
I think that's great. Anything else that you want to add about the strategy or its outcomes, or anything you may have learned about the process?
Well, I guess I'll chime in here. I'd echo too what Jennifer said, that last bit there. We're already putting these things to use. So, one of the kind of our guiding principle for all of this outreach was, work to talk to the people that this money is meant to benefit, and then also go to communal spaces, places that people are comfortable. So the town and the city both, when we had our public meetings for this, we made sure we had them in our, our respective libraries, places that are a little less, there's a little bit less grandeur than, or, just intimidation really than meeting or speaking before council or in a council chamber, which there's a place for that, but it's not necessarily the best way to get the most kind of informal, have the most kind of the best informal conversations with people. So that was a good takeaway. We've already started employing that with most public hearings and meetings we have for CDBG. COVID-19 has made that a little more difficult, with things having to be over Zoom and virtual where we can, but as soon as things are back to normal, I know that's a priority we'll maintain. Another important thing, so we focused, like I said, on going to where people were. So an important thing when you're doing something like this is to get a good hold on the outreach calendar of events in your community. So if you know something's going on, if something that's, especially if it's something that occurs annually, go to that. Try to, talk to who you need to, set up a table, talk to them ahead of time, get surveys circulated, whatever means you can. It takes a great deal of limited time and resources to promote your own events. So if you can kind of glom on to somebody else's and end up, helping those people too along the way, that's worthwhile. And you'll get much greater outreach and feedback than you likely would on your own. So that's an important thing. And then also I'd say we learned along the way to adjust your timeline if you need to, build in room ahead of time, but adjust your priorities or things you want to be looking into as you start to get feedback. So we had a stakeholder survey that went out to public service providers here in both communities. And as we started to get the survey results in, we had identified 5 different kind of areas where they were saying CDBG focus should be placed for their customers, the people they serve. And so based off that, we came up with 5 different stakeholder survey or stakeholder focus groups. And so we were able to, pull these people together based on what they'd said, based on what their expertise is in providing service, and then kind of, drill into their answers a little bit, see what they meant when they said that homelessness was an issue or that homelessness should be funded with CDBG. And based off that, there were conversations in those focus groups where ideas for future programs came up. And so, and a consolidated plan, as much as it is a framework for priorities over a 5-year period with CDBG, it's also a budget of sorts. So you have this work ahead. You put in this work with residents, getting their feedback, stakeholders getting their expertise, and at the end of it, you have something that's tangible. You can show people, you told us this. This is the we're going to hold ourselves in the community to these priorities. We're going to put dollars behind those priorities. So. I guess that kind of sums it up. That was another important takeaway we all got, I think.
I think that's great. And actually, just kind of hearing all 3 of you talk about it, it's evident that you thought a lot about the strategy as well as how you're executing it. So very thoughtful, and I think that really shows well, and it's definitely a testament to the award-winning results. I think what really stood out was the sheer number of contact points and outreach and things like that your group did. And that's really what kind of stood out to the jury. They recognized it's this is a lot of strategy, but then executing it was really, really well shown.
I'm going to give Lauren the credit for that. She was excellent at keeping the ball going without having a director in place to push her. She did a good job of keeping us on task and making sure that all of our shifts were covered and that we got to as many places as we could. So
absolutely, those 60 hours, 60 plus hours of outreach. I don't know, a good split of that was yours, a good majority of that. So
nice.
Yeah, it was totally worth it. You wouldn't think this was any of our first times doing something like this, but hey.
It was very polished and very strong when it came across for a review. So well done.
Excellent.
Thank you. You made it easy. Thank you.
Yeah.
So again, on behalf of APA Illinois, to you, Jennifer, Lauren, and Taylor, congratulations once again on the award, and look forward to see what comes out of the process. So very deserved award, and thank you all.
Thank you.
Thank you.